The mission of the Higher Education Center is to help colleges and universities develop, implement, and evaluate programs and policies to reduce problems experienced by students due to alcohol and other drug misuse. The center was reestablished at The Ohio State University in 2014 thanks to a generous grant from the Conrad Hilton Foundation. We are interdisciplinary in nature with strong partnerships between the College of Pharmacy, College of Social Work, Office of Student Life, the Generation RX Initiative, and the Collegiate Recovery Community. The Higher Education Center provides a number of services to colleges and universities, including technical assistance, technology development, education and training, and research and development. We are here to provide information and resources, help facilitate the use of research and practice, drive innovations in prevention and recovery technology, and provide training and assistance to our member institutions. You can connect with the Higher Education Center through email, social media, or via our website at hecaod.osu.edu. It is now my great pleasure to introduce Dr. Amelia Arria. Dr. Arria is an associate professor in the University of Maryland School of Public Health's Department of Behavioral and Community Health. She also serves as director of the Center for Young Adult Health and Development. Amelia received a BS in Human Development and Family Studies from Cornell University, a PhD in Epidemiology from the University of Pittsburgh, and completed postdoctoral training at Johns Hopkins University. Since 2003, she has been the principal investigator on the NIDA-funded College Life Study, which we will learn more about in just a few minutes. Her research interests include understanding risk and resiliency associated with underage drinking and illicit drug use, and translating research findings for parents and families. Dr. Arria has authored more than 100 scientific peer-reviewed publications and is the recipient of numerous grant awards from foundations and state and federal agencies. She serves on advisory boards for a number of national organizations, including the Higher Education Center. Dr. Arria will discuss non-medical use of prescription stimulants, what colleges need to know. She has provided a 5-page fact sheet called Non-Medical Use of Prescription Stimulants, What College Administrators, Parents, and Students Need to Know, which was sent to registrants prior to the webinar and will be posted to the HEC-AOD website. Dr. Arria, thank you so much for presenting today. I will now turn the program over to you.
Well, welcome everyone. Thank you so much for joining us, and thanks, Ken, for inviting me to speak to you today. Today what we're going to do in the next hour is hopefully enhance your understanding of what non-medical prescription stimulant use is, a little bit about the epidemiology of it, and give you some understanding of what are the most common sources of prescription stimulants, and more importantly, what are the risk factors that could be targets for interventions to reduce this problem. There are a lot of misconceptions about non-medical prescription stimulant use, and hopefully between this webinar and what you have in front of you in terms of the fact sheet, you'll be able to spread new and more accurate information about this problem. And then the last section, we're going to go through some very specific strategies for campuses to reduce not only the prescription drug problem, but hopefully the drug and alcohol problem in general. So before I get started, I'd like to just describe the College Life Study to you. I see that some of my friends are on this call and know about the College Life Study, but for those of you who don't, this was a very large prospective study of college students that began in 2003 with the screening of an entire freshman class at a large public mid-Atlantic university. And from that screening, we chose a longitudinal cohort of over 1,200 students to participate in an effort where they would be annually interviewed over time personally. So we had 2.5-hour face-to-face interviews with them. And on this slide, you can see the response rates every year. And what's unique about this is we followed the students regardless of continued college attendance, and we got great response rates because we incentivized them to participate, and they were also just very interested in becoming part of an initiative where we could learn more about college student behaviors. But over time, we were able to track them even post-college. So we have lots of data after they left college, no matter where their life took them. And I won't be presenting data from that segment of the study today, but we're working hard on getting some publications out on what happens after college with this problem, with prescription drug problems. So besides alcohol and drug problems as sort of the main dependent variable of interest in the college life study, we looked at a lot of other risk factors and domains of functioning, including variables at the individual level, variables at the high school level, their experiences with their parents prior to coming to college, stress, mental health, parent influences during college. And one thing I should say is that what I'm going to be talking about today with non-medical use of prescription stimulants really pertains to the non-medical use and not the treatment of ADHD. So these drugs have beneficial effects and beneficial uses in a clinical context, and that isn't really what we're here to talk about today. That's a whole separate issue. So maybe we can, if you're interested in that, maybe we can bring it up in the Q&A session. But what do we mean when we talk about non-medical use of prescription drugs? It's complicated, and the reason why I don't really use the term prescription drug abuse is because that implies that there might be some sort of criteria of problems associated with the use of the drug. So we just use a very generic term, non-medical use, and that is when you are taking a prescription drug that was not prescribed for you, that is, you did not have the prescription, or you're taking the drug from your own prescription, but you're taking it in ways that are inconsistent with what the doctor wanted you to use it for. So you're taking it for a different reason, or you have leftover prescriptions, or you're taking it for some experience or feeling that it caused. So there's both overuse of your own prescription as well as use of a prescription that comes from someone else.
Okay, so now it's time for our first polling question. Why do you think most students use prescription stimulants non-medically on your campus? A, out of curiosity, B, to party, C, as study aids, or D, to relieve symptoms of depression?
So what we see on this graph parallels the results of the poll parallels what we hear all the time, and that is that the most common reason for using these drugs is to enhance academic performance. And we're going to talk about that because that really is the most common motive for using it, but unfortunately it doesn't appear to work out so well for students who take it for that reason. The other reasons are important too. Curiosity is often seen as a motive for using these drugs in the very earliest years of college, but then this myth gets perpetuated that these drugs will help improve concentration, or another reason for using them is to stay awake longer, to drink more, or to get high just from using the drug itself, but that's a less frequent motive. And then there's often talk about whether or not these drugs help relieve depression symptoms just because it's a stimulant. But it's very important to make sure that we understand the difference between the reasons why students report using it, the motives, and what the real risk factors are, because we as public health researchers really try to figure out what the underlying risk factors are to intervene on rather than simply the motive. And that's what we're going to be spending the most of the time talking about. the most important thing to realize is to frame this in a developmental context. The reason why college students excessively drink and use drugs, either non-medically or illicit drugs, is because during this developmental period, their brains are wired for risk-taking. And risk-taking is a very developmentally normal process, although it can lead to quite dangerous situations. But one of the most important lessons that I learned from my 21-year-old stepson was that one of the reasons why students this age engage in this behavior is because these bad decisions can make a really good story that could be retold over and over again. And retelling of that story, whether they're posting it on Facebook or telling it to a friend, has a lot of value to them. And that's something that we really need to take into account, is that this is a very different sort of brain that we're dealing with, this adolescent brain, and that because emotions are driving decision-making during this developmental period, we need to be the more rational part as adults and trusted adults in their life and parents and teachers to get them to think more rationally about their decision-making process. So let's look at some data on the epidemiology of non-medical prescription stimulant use. And here, data from the College Life Study shows that over time, I'm not sure if you can see the mouse, but over time, prescription stimulants in the first year of college, it starts out at about 10%. There's a big jump in prevalence in the second year, and then by the end of the fourth year in this particular sample, 30% use a prescription stimulant at least once in their lifetime. And that is comparatively shown in contrast to marijuana, which 63% used over the 4 years, and prescription analgesics, 23, prescription tranquilizers. So there's quite a high prevalence of drug use during college, but it's important to realize that not everyone, obviously, is doing these sorts of things. And even more importantly, among the users who tried a prescription stimulant, the frequency of use is actually very low. So they're taking it on a very sporadic basis, where over time, the frequency of use doesn't really increase that much. And if you, let's say you did have ADHD and you were asked to take this drug by a doctor, this number would be 365 if you were taking it every day. So this means that it's less than once a month on average in the second year of college, and it's about monthly on average. Of course, there are some people who are taking it more frequently. And then when you look at the national data among adolescents, stimulants are represented by the red line, and you can see that the proportion of people who are taking it at a very young age is very, very low. Over time, this is past year non-medical use among 12 to 17-year-olds, and it's only 1.3% of that population. When you move on to 18 to 25-year-olds, the prevalence increases. But when you look at the whole population over time, it's 4% of the population have tried a stimulant in the past year. This is not accounting for college. Now, when you look at college attending students versus non-college attending students, you do see that in the past month, the stimulant use is the only class of prescription drugs that exceeds, that is higher among full-time college students than it is among other people who are aged 18 to 22. So same age group. The only difference here is that this group is college attending. For all other prescription drugs, for non-medical use of other prescription drugs, it's more common that non-college attending youth are using the drugs. But in stimulants, it's more popular among college students. And there doesn't appear to be significant gender differences. This is just one slide from the national data, but over and over again, we really don't see too much difference by males and females in past year use of non-medical drugs, no matter what type it is. A little bit excess prevalence in males or in females, but nothing to really write home about. And here's among college students as well. So what about students who have ADHD, who have their own prescription meds? And this is what I was talking about when I mentioned that overuse is also an issue. So 27% of first-year college students with ADHD will overuse their own medication, and 16% of them, it doesn't seem to make sense, but they will non-medically use someone else's ADHD meds as well. So this is a target group for intervention as well, not only the non-ADHD clients, but the people with ADHD often overusing their own medication. And this is another sample of 55 students who are around the age of 21. And again, we see a fairly high proportion of them misusing or taking too much of their own medication, with a small proportion of them grinding or sniffing the drugs. And what is interesting about this group is that a lot of them also meet comorbid criteria for conduct disorder and other substance use disorders. And immediate release formulations are associated with more abuse or misuse than the extended release versions. So we find that 41% also will use, 41% of ADHD students will use the stimulants non-medically. And when you look at whether or not the non-medical use occurred before or after, what you find is that in 18% the non-medical use occurred before the medical use, and then in 23% the medical use occurred before the non-medical use. So it can go either way. So I think we're going to pause for a second poll question.
Okay, yes, thanks, Dr. Arria. This is our second poll question. We're getting ready to talk about the source of these drugs. So what is the most common source of prescription stimulants used non-medically by college students? A, fake prescription, B, the internet, C, a relative or friend, or D, a drug dealer? Clearly, it's a pretty savvy group that we have in attendance. The vast majority of our respondents, 50, Dr. Arria, out of 64 responding, indicate they think it's a family member or friend.
Right, and that is exactly what we find. In these next slides, I'll show you data that friends and peers are the most common sources for prescription medications to be used non-medically. And when people talk about this, the friend is the one with the ADHD medication prescription. So they are the ones diverting the prescription stimulants, either sharing, selling, or trading with someone else. And we do find evidence of trading, which is a little disconcerting because a person has one type of drug and they're trading it for another, and obviously they weren't, that was not under doctor's orders to trade prescriptions. So here we show the majority is getting the prescription drug from a friend or relative for free. Sometimes they're buying it. Stimulants are the most popular drug to be sold, but seriously not for very much. And for over time, the pattern of where they're getting it over college does not appear to change very much. What is really interesting is that even though there are internet pharmacies out there, rogue internet pharmacies, they do not appear to be the main source, or at least the primary source of prescription stimulants or any other prescription drugs for that matter. So let's talk about some of the risk factors. the most important thing to know is that alcohol and drug use is strongly associated with non-medical prescription drug use. A lot of times people talk about prescription drug use as if it occurs in a vacuum, and that students who are affected by this problem, this is the first thing that they've tried, or this is the only thing that they use. That may be what they're telling their parents, but typically when you ask them on surveys, and we've done it and all across the country, other researchers have found that it's inextricably tied to other alcohol and drug use. So longitudinal studies have shown that non-medical use will increase the risk for other illicit drug use. Medical overuse, if you're an ADHD patient and you medically overuse the drugs, the same thing, that will increase your risk for other forms of illicit drug use. But medically supervised use for ADHD actually seems to decrease the risk for other illicit drug use when ADHD is treated well and in a beneficial way and the drugs are used in the right way. It'll actually decrease the risk for other illicit drug use, or you won't find any increase in risk if it's used the way that the doctor wanted it to use. This is a very simple way of looking at the lifetime history of other drug use among non-users of prescription stimulants and non-medical users of prescription stimulants. So in the right-hand column, you can see that the rates of using tobacco, marijuana, hallucinogens, cocaine is all increased relative to students who did not use prescription stimulants. And some of these are very, very high, much higher than the non-users. So 41% had used a hallucinogen in their lifetime, 18% cocaine used. And interestingly, 95% or 93.5% of non-medical users of prescription stimulants also have used marijuana in their lifetime, and as we'll see, they're current users of marijuana, which makes the story very interesting. Another important risk factor is overestimation of how many other people are using it, so peer norms are important, and also sort of overinflating the benefits of prescription stimulant use. So having these expectations obviously raises the risk. Here is just a graphic showing that when you ask students on a college campus how many people are using prescription stimulants non-medically, sometimes you'll get an estimate of about 3/4. They'll say that's how many people are using it. But in reality, when you do the survey, you find out that maybe 10 or 14% have used prescription stimulants. So there's this increased inflation of how many people are actually doing it, which is a risk factor. So we'll pause for the next poll question.
So here's our third poll question, and we are thinking about the risks, risk factors with students, and we'll continue thinking about the characteristics of these students, which is true with regard to the typical non-medical prescription stimulant user. A, they spend less time studying. B, they skip class more often. C, they have lower grades. Or D, all of the above. So it looks like there are a few different answers, but the vast majority, Dr. Arria, are thinking that's all of the above.
And that is exactly true. We have a very smart group that could be given the webinar themselves. This is a really, really important point. A lot of students believe that non-medical use is associated with gaining a competitive edge, and this could not be farther from the truth. So we have found in both cross-sectional studies and in longitudinal studies, non-medical users typically spend less time studying, they skip classes more often, and they take stimulants as a compensatory way of trying, as sort of a last-ditch effort to improve their grades. But what we find is that on average and over time, they earn lower grades, which is a very, very important message to get out. When we did this work longitudinally, what we found is that if you look at what are the predictors of skipping class and decreased academic performance, what you find behind those processes is that marijuana use is sort of responsible for students' poor academic performance. So the real culprit here appears to be marijuana use, more frequent marijuana use leading to skipping class, poor academic performance, and we even have data showing increased time to graduation, which sort of leads up to the non-medical use of prescription stimulants for studying. This is important because it presents a screening opportunity for students whose academic performance is declining. And we're working in Maryland on protocols to screen for marijuana use at its earliest stages in academic assistance centers where you can identify students who might be on this academic performance decline. The other important risk factor is that if students perceive a lower level of harm, they're going to be more likely to use it. So messages that increase the perceived risk of prescription stimulants are also important, both for stimulants and analgesics. This is just a finding. Don't worry too much about the graphs here. What we found was that for analgesic use, though, you have to be careful in that there are subsets of drug users out there, and those who have high levels of sensation-seeking or novelty-seeking, the extreme risk takers, will not respond to messages of perceived harm. So they're the students who are most at risk for drug use, but they're also the ones who, when they hear a message, oh, that this is risky, they're going to be more likely to say, bring it on, because they like risk. And so a message of increased risk is not going to influence a person whose purpose in life is to take risks, basically. The other risk factors that we and other people have studied is this idea that early conduct problems precipitate or increase the risk for other drug use, and attention problems. One of the most common questions I get is, well, maybe students who are taking ADHD meds non-medically actually have ADHD. And it's a very difficult question to answer. This is if you're interested in this paper, I can talk about it more in the Q&A. But basically what we found was that inattention symptoms do appear to differentiate non-medical users of prescription stimulants from other types of drug users, marijuana users, but the overlap with other drug use is still there, so it's hard to separate whether or not the inattention that we find is coming from the other drug use or whether it's really a result of some underlying ADHD and some self-treatment with prescription stimulants. We really just don't know. So let's summarize some of the myths and misconceptions. These are some common misperceptions. And this is what your handout has a section called Myths and Realities, and some colleges have found that it's very useful to talk about this in different formats with students. Obviously, this is, you can distribute this free of charge. Go ahead, we want it to be used. So we're going to pause for the next poll question, Ken.
Thanks, Amelia. So Amelia is about to, I think, bust some myths for us. We're going to ask what your perception of these myths are. So what myths regarding non-medical prescription stimulant use do you perceive to be most prevalent on your campus? A, these drugs are safe and can be used without liability. B, a high percentage of students are using them. C, using these drugs will improve my GPA, or D, all of the above. And Dr. Arria, as we'll see here in just a second, it looks like there are a few answers across the board, but the far and away the biggest response was actually all of the above.
here. We were interested in finding out what is going on your campuses, and I think that when there are a lot of misconceptions, it makes your job harder because you've got to try to align the students' perceptions of these with the real evidence, and that's a hard thing to do if they have a lot of misconceptions about it. But you're exactly right. All of the above is a problem. So not everyone is taking them. It is not the norm. When things are considered deviant, it makes students think twice about taking it. Students are much more likely to engage in behaviors that they think are normative. Again, in 2013, from Monitoring the Future, we see only about 11% of full-time college students are using them. But again, if you ask on your campus, people are going to think that it's a lot higher than that. Sometimes people say, well, students perceive them as safe because they're prescription drugs. That's not exactly true. They don't actually perceive them as that safe, and they're aware that non-medical use does have risks. They're just willing to overcome that risk because of the supposed benefit that they're going to get. So it's better to work on the expectations that it's not going to achieve the benefit that they think it is. But in terms of the risks, we don't really know. The reason why doctors are involved is because they know the patient and they know whether or not there are contraindications to taking the drugs. There is a risk for dependence, although it may be low. There may be risk for other forms of stimulant dependence, like cocaine later on, that we're not completely sure of if a person takes stimulants early, whether or not they'll proceed to a different type of a stimulant. And then there are these acute health consequences where people feel jittery or their heart's beating, or they'll, worst case scenario, have some sort of a seizure or heart attack, or find out that they have some underlying cardiovascular condition that was a contraindication to stimulant use. The other issue is, and this is a tricky one, that most users will do well academically, and a lot of colleges have talked about putting it in their academic policy guide as a way of cheating. And I feel tossed about that because it really isn't cheating. It's not improving their academic performance. So if you call it cheating, it sort of lends credence to the myth that it makes people do better on exams, where it really doesn't. The most important thing you can do here is make sure that they understand that it's not going to help them with their grades, that it's really just a compensatory strategy. A lot of the times when people say, well, it really did help me, I'm convinced that it helped me study, I was more effective on the drugs than off the drugs. We really, from the literature, there doesn't appear to be any benefit cognitively to using these drugs if you do not have ADHD. A lot of the performance enhancement appears to be driven by a placebo effect. And I think that there are a few studies showing clearly that the expectations are what's driving the performance increase. So it's not really a biological pill to make you smarter. I always say we're not there yet. We don't have the little blue pill. Myth number 5, it's easy to share with my friends. They think that it's helping their friends if they're approached, if they're an ADHD. If they've been diagnosed with ADHD, they think that they're going to help their friends. It's really, really important to share the legal consequences and encourage anyone thinking that they need a prescription stimulant to go see their own physician. So to make sure that we have enough time for questions, I'm going to go through this last section, and there's a lot of material here that you might want to go back and share with your respective health center directors or counseling center directors. Within the health center, it's important to make sure that rather than just banning the prescription of ADHD medications, there is an alternative where you can make sure that ADHD patients are screened appropriately for other drug use, that the risks of diversion are conveyed very well, that people who are academically struggling are screened for not only prescription stimulant misuse, but also marijuana, which is probably the main culprit, and excessive drinking, for lack of engagement in school and going to class regularly. It's important to realize that time management, getting enough sleep, all of those things are the things that we should be promoting rather than taking shortcuts to improve academic performance. In terms of ADHD patients on your campus, there's all kinds of strategies that physicians can use to decrease the risk of diversion and make sure that stimulants are not being non-medically used. Compliance is a big issue, making sure that they're thinking about drug testing to make sure that marijuana isn't on board at the same time they're taking ADHD medications, but making sure that the monitoring of the prescription drug is done with regularity. Regular dosing, safe storage, discussing the ethical issues around diversion. Parents have a role to play as well, even though, you know, everyone wants to breathe a sigh of relief when their child goes off to college. A parent's job never really ends, unfortunately, for those of you who have college-age students or kids. It's really important to not condone or facilitate non-medical use because you think it's going to help your child get better grades. We've heard from our college life study participants that they have told their parents that they're sharing their friends or their roommates' prescription stimulant meds, and that they haven't met with any resistance. In fact, some parents say, well, if that's the case, let me go find you some prescription meds from, you know, a relative who's a psychiatrist or something. And that is problematic because the parents are only getting part of the story. They're not getting the part of the story about excessive drinking and marijuana and other drug use. They're just seeing the top layer of this problem. So asking more questions about really what is going on that is leading to the academic performance declines is a good strategy. Colleges and universities are continuing to discuss this issue. Ohio State is a leader in this area where they're bringing people together and having these ongoing dialogues. I really think it's important to put your action plans in writing, not just to have meetings about what you're going to do, but actually have strategic plans about who is going to be involved in the interventions and what steps are you going to take to evaluate those interventions. One simple thing is to have students really rethink whether or not taking 18 credits in the first year of college is a good thing. I think high-achieving students come right out of high school and they've gotten A's most of their life, and they think that they can just hit the books hard, and the first year of college is very, very stressful. And if you remember the graph where we saw that increase from first to second year when students are most vulnerable to taking prescription stimulants, it's because they probably feel very overwhelmed, are starting to party with with marijuana and excessively drink, and they're burning the candle at both ends. And so I think that just going slow and steady and experiencing small academic successes over time is probably a better strategy for advisors and for parents to encourage that and save the 18 credits when they're more used to it, when they have to catch up in their senior year. but academic advisors need to be part of this discussion. And also, students typically have a very low perception of any kind of enforcement. They really don't think anything is going to happen to them if they divert a prescription med or they take it. And that's something that we're trying to work on in Maryland, is making sure that the enforcement part of this is clearer. Students have to be part of the conversation. They have to change these misconceptions. They can use the evidence that non-medical use is associated with other forms of drug use to make this behavior, they can consider this behavior more deviant. And also to dispel the myth that taking these drugs is going to actually help academic performance, and that it's driven mostly, if there is academic performance improvement, it's probably a placebo effect. More on the individuals who have ADHD meds, protecting their medication, keeping it in a safe place, encourage responsible help seeking rather than just sharing prescriptions, and adhering to their provider's instructions. Okay, I think this is our last question.
It is, Amelia, and so we're going to go back to the question that we mistakenly showed you at the very beginning. And so hearing what you've heard so far in this webinar, we're wondering, where now do you see the strongest possibilities for translating this information into action on your campus or in your context? Would it be peer education, A, B, student health service center practices, C, parent education, or D, ADHD patient education? And Dr. Arria, it looks to me like we have a strong vote for peer education in this model, in these responses, and answers across the board, where a lot of folks are looking at ADHD patient education as a good possibility, as well as parent education and student health center practices. So we have kind of a mixed bag of opportunities here in front of us.
Right. I think that that's, it's interesting that the peer education turned out to be the most likely for translating the information, because often students are very resistant to the idea that this type of drug use is associated with other forms of drug use and excessive drinking. They really do want to believe that this is something very separate, but I think that maybe what is reflected here is that you've heard on your campus that there are students who already get this, that the friends that they see using prescription stimulants non-medically are that they realize that this is probably just one facet of an alcohol or other drug problem, and that they're interested in making sure that those students get the help that they need, rather than continue on the path of just sort of having these shortcuts, and that they're all interested in student success, which is really, really important. There are other opportunities, though, very standard opportunities for clinicians in the Student Health Center, educating parents about this issue. A lot of parents that we talk to have absolutely no idea that this is really the true story, that these drugs that are purported in the media to be smart drugs are not really smart drugs. So I think that the extent to which you can disseminate this information to a wide group of people through your various channels, through the counseling center, academic affairs, is going to be very, very helpful. So just to summarize the findings here, the exposure opportunity does increase dramatically in college, even though the numbers are fairly low in terms of the prevalence. On your fact sheet, you'll see that the number of people who are offered the opportunity is quite high. So in a cumulative way, almost 2/3 might be offered the opportunity to try a prescription stimulant non-medically, whereas only 30% will take someone up on that opportunity. So only about half of those offered will eventually take that opportunity. And we know that it's widely available. We have to do something about that availability by making sure that students who have ADHD are more protective of their medications, and we reduce the rate of diversion. Diversion is a huge problem. And to sort of get into the common knowledge that this is something that is it's a facet of other alcohol and drug problems, that it's not just about this particular drug and reducing its availability, but it's about dealing comprehensively with excessive drinking and other drug problems on campuses. Even though we can put into place strategies to reduce availability of this particular drug, there's going to be other risk factors driving the overall problem of excessive drinking and drug use, which is a developmentally normal kind of behavior at this age. We just need to do more in terms of intervening. So you can see our website for more information. I'd be happy to share with you some of the scientific publications around this. And I think we're going to go into the Q&A session, Ken?
Absolutely. So thank you, Dr. Arria. You're fabulous. We are honored to have you be on the advisory board for the center. And it's always a pleasure to hear you speak. So thank you for sharing this information with us. We have a set of questions. Some of these things you've touched on, and maybe we'll see if you want to kind of embellish them a little bit. I will remind our audience you can still submit questions by using the Q&A icon with the question mark in it. Our host will be watching for them, but we'll go ahead and get started. So are you ready, Dr. Arria?
Yep.
So the first question is, early on in the program, you showed us a slide that said that 27% of ADHD patients actually overused their medications. So the question came in as this: is the overuse of students with their ADHD medications based on the belief that more is better, and they will be a better student if they overuse their meds?
That's a really good question. We're not really sure, but only a few papers have come out documenting that students with ADHD are actually overusing their own medication, so we need to find out more about that. One of the issues is that ADHD itself is tied up with a risk for other drug use. So oftentimes, they're behaviorally dysregulated, they're at risk they've used other drugs in the past, and this is just sort of a sign that they may be increasing the frequency of their medication as just another drug. So to me, it's a symptom of maybe an accelerating drug problem, and there's probably other drugs that they're using more frequently as well if they're overusing their own medication. So that means that you've got a drug test for other drugs. It could be that they're increased risk for drug dependence later in life. Does that make sense?
Makes sense to me. So let me ask you another question, Amelia. So do you have suggestions for how college student health services could better regulate or control the prescribing or use of prescription stimulants like Adderall?
Yes, I have talked to a number of really very careful psychiatrists who have really offered the suggestion that it's probably not a good idea to just have as a policy, well, we're not going to prescribe it anymore, because that sort of hurts students with ADHD in the long run. So certainly not going in that direction, but having very, very careful screening processes for new patients who say that they have ADHD or who report having attention problems. And one of the strategies that psychiatrists recommend is urine toxicology screening for other drugs on almost every visit, or on a monthly basis, or on a very regular basis, so that they know that they're treating inattention that is related to the ADHD and not the use of other drugs or being hungover, that the attentionitis that they're treating is really part of ADHD rather than overdiagnosing the symptoms. And I think just careful monitoring and vigilance of diversion, behavior, pill counts, check-ins, making sure that they're adhering to the treatment regimen and that they understand the risks of diversion. So Tim Willens at Harvard is a great resource for this, and Mark Fishman here in Maryland is a great resource for describing what clinicians should do better around prescribing. And actually, there should be some, maybe I could get this for you, Ken. There's a TV talk show that Mark Fishman did on this issue where he goes into this question a little bit more that I could get you the link for.
That was a great response, Amelia. So, I mean, I'm hearing better screening, including urine tox screens, better monitoring, better education, and you even talked a little bit about the prescriber end, so better healthcare practices at that end as well. Does that encapsulate your response?
Yeah, I think we've done a lot of work on, and we haven't solved the problem there either, on prescription analgesic use. We've certainly tried to raise the level of vigilance about prescription analgesics, painkillers, and those same rules could be applied to prescription stimulants as well.
Yeah, it's good stuff. So here's kind of a general question. How else can we better prepare our students to use prescription medications, I guess, in general, safely throughout their lives? So, you know, we talked about avoiding diversion and misuse. Do you have thoughts about how we approach this from a safe use perspective?
Yeah, I think that's a really, really great question. I think that just the increasing responsible help-seeking behavior is really, really critical. I don't really know how to do it. I can just underscore the importance of doing it, and having two college-age kids of my own, I know how difficult it is because they don't want to listen to adults. But I think that on one hand, there's the problem of, let me just take this drug. I don't really know what it is. I'll just use it. And then on the other hand, when students have mental health conditions, they don't want to take medications for it. They want to pretend that it's not a real condition and that they have, they can exercise their way through depression, or there's a lot of myths about the benefits of psychiatric medications where it's a real imbalance sometimes. So I think just discussing the whole issue of medications are essential, and we live in an age where we can benefit from all of the science and the research around responsible pharmacologic interventions, and pharmacology is a good thing when you follow the prescription or when you follow the physician's instructions carefully. But on the other hand, the recklessness has to be toned down of, well, if this drug improves my mood or makes me feel good or better, I should just take it, and that kind of recklessness. So it's a real tough issue. I don't really know how to do it, but I know that there's some very divergent attitudes about prescription meds. And I actually think it starts really early on with better role modeling by the adults in their lives, that you're not always reaching for a pill in a reckless way when you're growing up. You don't see your parents doing that, but also making sure that if you have a condition that requires medication, you're very compliant with the doctor's instructions. So I don't think I answered that question very well, but
I think you answered it really well, actually. And for me, coming from a college of pharmacy, Amelia, I think you nailed many of the things that we would agree with in my college. We kind of grow up in a drug-taking culture, don't we? So we're actually fighting kind of the norms that they've grown up with.
Yeah, yeah. But then you see a lot of, I deal with a lot of students who don't want to take their meds if they have a psychiatric disorder.
Yep.
Where it would be beneficial.
Yep. So here's a question. Go ahead.
I think the difference is with SSRIs aren't going to change their mood or make them feel good or better, so they don't want to take those. But they want to take drugs that have a psychoactive potential, and that's the difference.
So here's a different sort of a question. I think dealing with sort of the tendency to have drug take-back days or possibilities on campuses, is there any evidence for having drop-offs for unused prescriptions, either in reducing availability or sending the message that students should use care in disposing of unused prescription medications? You have any thoughts about that kind of disposal drug take-back piece to this?
Yeah, I know that they're very, very popular and that they're sort of catching on at the federal level. I haven't, and not to say that there isn't data, but I haven't followed that literature very carefully to see whether or not they are effective in reducing availability. But I would assume because there's a lot of push for that, that it's important and that it is working. I don't really see a downside to having it. It probably illustrates the fact that there's a lot of unused prescriptions floating around. So I think that in that sense, just getting rid of leftover prescriptions is a good thing. But it would be interesting to add that to the next time to look into that literature, because I know that some people have tried to look at the effectiveness of it.
Yep. So if we think about social norms, Amelia, are you aware of any successful social norms campaigns working to correct misperceptions around non-medical use?
No, but there might be some people on the call who are more familiar with those interventions, who are using them in their own campuses. Sometimes people are doing things that seem to be very effective, but they don't end up in the scientific literature. And so we really need to have people who are finding success or not success with that to report their experiences. Social norms in general for alcohol use have a mixed, sort of the literature is mixed on them, whether or not they're very effective. Sometimes I think that they might be more effective in some places than others. But I definitely think that it's not just the prevalence of use that we need to correct, it's the expectation of the benefit. And if we can somehow change people's minds about the benefit and make that part of the social norms campaign, that might be more effective than just not everyone is doing it, that's the message. So there could be two messages there.
Yeah, interesting point. So next question is this: do you know of a brochure for parents of students with ADHD and other college students that presents the information you mentioned parents should know? So I guess I might broaden that a little bit too. I mean, how do you think we should better educate students with ADHD about the risks of diversion and parents of these students about busting some of the myths that you've explained to us?
Yeah, that's a really great idea. To have something just focused on parents, like, so your child is going to college and they have ADHD. What is your role? What is your physician's role? What can you expect from your campus health center? How often should you check to make sure that your student isn't overusing? Or I think that that's a wonderful idea. I don't know of anything that's based in the literature, but I would love to know if other people have that kind of a resource. Mm-hmm. But it's a summer project for someone.
There you
maybe
go.
In our office.
So maybe a follow-up to that. Do you have any thoughts, Amelia, about how we better prepare ADHD students to, kind of avoid or deal with people who are going to be seeking their medications? How do we teach them to deal with that phenomenon?
Yeah. I think that's both that's the one-on-one conversation that has to happen in the doctor's office, or with the nurse practitioner in that doctor's office. And then that same message has to be continued at the time of prescribing, I think, with reinforcement from the parents. So but again, you know, I'm a public health researcher, and I would love to see someone try to target that specific behavior and see whether or not we can do the right thing to reduce the risk of diversion. I don't know if there's anything out there that is targeting diversion risk, like any standardized interventions yet.
Yep. So I think this next question is sort of a follow-up to that one about the overuse of ADHD medications. It says, could it be possible that the primary care provider is not knowledgeable in medication dosing for adult ADHD patients and are giving students a dosage that is not therapeutic, and that they are simply trying to self-medicate to get a better outcome rather than just misusing it? Do you have any thoughts about it? Do you think it could be misprescribing?
Yeah, definitely. I think that that's a possibility, but I think that the issue of whether or not they are better at figuring out their therapeutic dose than their physician, I don't know. I wouldn't want to go there, because the patient has an N of 1 and the physician has, you know, a whole career's worth of dosing experience. So certainly it's a possibility, but Ken, you might know better. Like, is that something that doctors tend to do wrong, not get the dose right? I mean, hopefully there would be more, like in Mark Fishman's office, who's the psychiatrist in Baltimore. He works not only with the patient, but he has a therapist on all of his patients, and that therapist talks about the effect of the medication on a routine basis with the patient. So that is one of the primary reasons why he has a therapist talking at the same time he's dosing.
Yeah. I guess, you know, I would agree with everything you said, Amelia. I don't see, from our perspective, evidence of the prescribing, the dosing as being problematic. I think we're more concerned about the screening that you already pointed out, and the monitoring steps that are in place, and the holistic approach to, you know, how do we treat this patient besides just going straight to the drugs first. So I guess I haven't seen evidence of that, at least in the work we're doing. Next question is, do you see any difference among ethnic groups in terms of higher usage of non-prescription drugs? You know, which ethnic group shows higher, or is there any difference between them?
It appears that whites are at much higher risk of non-medical use of prescription stimulants. And in a college setting, that does appear to be true. I'm not sure about the population-based data, but definitely whites are at higher risk. And in this case, access to health care increases your risk for being treated. Mm-hmm. So I think that people have talked about how we sort of have two problems going on. One is the lack of proper diagnosis of ADHD in underserved populations, and the overdiagnosis among people who have plentiful access to health care, which is among the affluent. So there's sort of an imbalance going on in terms of the diagnosis of ADHD, the diversion of medications, and the access. But non-medical use of prescription drugs in general is concentrated among whites, except that 100% of people are at risk, obviously.
So the next question, do you have any understanding of why immediate release stimulants are more misused than those that are extended release?
Yeah, that's an easy question. The immediate release has a biological effect of feeling higher sooner. So you get more of a a benefit in terms of the psychoactive benefit, you get it with the immediate release Adderall. And some countries in Europe don't even use immediate release anymore at all. So, and physicians in this country are trying to get away from that and using, when it is therapeutically effective, the longer release formulations, which are not associated with non-medical use because you're not getting the acute surge. It's more degraded over time. And you might have a more biological explanation.
That was perfect, Amelia. You're dead on. Let me ask a question. Here's another one. Have you seen any effective college campuses, campaigns, posters, websites, etc., that are good examples for the audience, institutions that you might suggest to look at, to consider as best practices?
Our federal government is now funding colleges to try things and to gather data on what is effective. And so hopefully we will have a more scientific answer to what is effective in the next couple of years. But I think before that, a comprehensive approach is the best one to take. Trying to infiltrate in different sectors of the campus and making sure that from the leadership down, this is something that your campus has decided is a priority. Rather than taking shortcuts and using non-medical prescription drugs, we're going to promote student success in other ways, and making this sort of a culture of student success rather than a culture of partying and drug use. And that's a message that has to come from the leadership. But making sure that it's not just in the student affairs office, it's not just at the health center, that it is infiltrated across faculty, students, parent and family affairs, clinicians. It's got to be the same message across the campus.
Environmental, holistic approach, kind of sort of a culture change.
Well, and it goes for all forms of drug use. I think that's where colleges are underfunded and under-resourced in terms of making sure that this is a priority, but it's affecting the bottom line because it's affecting student success.
So, Amelia, I have a couple of questions here relating to recovery programs. First is, what is the role of campus-based recovery programs in your estimation as it relates to these prevention and intervention programs?
Well, I think that people should be aware that you're having the meeting on August 4th and 5th because you're going to have an emphasis on recovery for sure, and relating campus recovery programs to these efforts. You guys have been a real leader in that. The one thing I will say is that one of the intervention strategies to reduce substance use in general is to give non-using students a much louder voice. Not just students in recovery, which are great role models as well to show that you don't need drugs to succeed in college or to have a good time in college or to take advantage of all the opportunities in college. Students in recovery are a great example of that, but just students who never had a problem or never used drugs, that they're doing absolutely fine. And to get their stories out, just like I was saying, that sometimes the stories, the risky stories get perpetuated because they're dramatic. We need to find a way of getting the non-using students to talk about how well they're doing or the internships they're getting or the trips they're going on, and getting them to be on par with their stories of success.
Mm-hmm. And a sort of related question, do you have any thoughts on supporting a student in recovery who could benefit from a prescription medication but is fearful of dependency?
That's a very clinical question.
Mm-hmm.
There's a lot of literature now about how to prescribe pain medication to people in recovery. And it's a great question about whether or not a person in recovery who has ADHD, which is perfectly possible, how physicians deal with that. And I think it's just through compliance and drug testing and all of the things that good doctors do to keep students in recovery. But that's kind of a clinical question. I'm definitely going to put that on, the list to talk to people about.
Yeah. I've got a couple of people asking about, do we have data telling us about drug-seeking behaviors for ADHD medications and, students misrepresenting symptoms? And do we see this as being prevalent in terms of, doctor shopping, that sort of thing?
It doesn't appear to be, if you look at the slides on sources, faking a prescription or faking a diagnosis isn't a prevalent kind of a behavior because it's so available from the other sources. So we don't see a whole lot of that, but we do get reports from doctors that is happening. So it's not negligible, it's just less than getting it from a friend for free. They don't really have to go there because it's so much easier to get it from friends for free. Now, if that went down, I don't know, maybe it would be true that they would go to doctors. The one thing that Dr. Willens from Harvard has told me is that he has a rule that he will never prescribe on the first visit, that he does the assessment, goes through everything, and then he says, we'll come back and we'll do another assessment and I'll give you your prescription meds at that time. And he finds that they won't come back the second time if they're just trying to fake a prescription. So that's a very simple strategy, but he said that it does seem to work. And then he institutes drug testing and a lot of clinical history about when did these issues start and,
So we're really hitting you hard with these questions, Amelia, but here we're kind of going a different direction again. Do you recommend campus AOD policies address non-prescription stimulant abuse? Should students who share their medications receive sanctions in addition to the students who misuse them?
I think that enforcement of sanctions is a good idea. The sanctions have to fit the crime. I think that making it is illegal to share a prescription, and I think that there is a benefit to getting the word out that these are illegal behaviors, because certainly when they go out into the real world, you don't want them to think that it's perfectly safe, because in the real world, the illegality might hit them a little harder. I always see those as opportunities for intervention. So if you have a sanction in place and you can use it as an opportunity to find out what is going on with that student, rather than just, having them watch a video, which is what we get as reports of what students are asked to do when they receive a sanction, but a real comprehensive assessment with a clinician, monitoring over time, making sure that they understand that now that they've done that, they're going to be closely monitored. I think all of those things are important. But something like throwing them out of school could be a sort of a third offense policy, but not necessarily a first offense policy.
So, Amelia, thank you. I'm going to ask you one more question. I think the Q&A part of this webinar has been really, really good. I think one of the best I've ever heard on a webinar. So thank you for indulging us on all these questions. But I'm going to wrap up with one more question, and then I'm going to go to just a conclusion for the webinar. But you've told us that the non-medical prescription drug use seems to be strongly associated with alcohol and other drug use. And maybe you've hit on some of this, but do you have thoughts on how we might better integrate prevention programs for all these various substances?
I know we don't have too much time, but I think that the standardized screening and brief intervention can be done for all types of substances, from alcohol all the way down, to identify high-risk users, and closer to more universal screening, and definitely screening in academic assistance centers, screening and healthcare visits to make sure that you're not just screening for one substance, but you're screening for multiple drugs. And it's not hard to do that with checklists.
Well, Dr. Arria, you've done a fabulous job. Thank you again. Thank you for being with us. I want to thank all of our attendees for joining us today. I invite you to keep in touch with the Higher Education Center via email, social media, or through our website. If you would like to hear more and meet Dr. Arria, she will actually be a keynote speaker at the inaugural national meeting of the new Higher Education Center. She's mentioned it to you. It's August 4th through 6th in the Blackwell Inn and Conference Center at Ohio State. We invite you to engage with Dr. Arria and other keynote speakers, Drs. Peter Lake and Kitty Harris, and participate in an exciting slate of breakout sessions relating to high-risk drinking and drug misuse prevention and, as Amelia pointed out, recovery. You can register for the national meeting at hecaod.osu.edu. And let me just say thank you once again for joining us today. We sincerely hope that you will use what you've learned here today to help prevent the misuse of prescription stimulants on your campus. Any final words from you, Amelia?
No, thank you so much. It's sort of, hard to speak to no faces. So I hope you will join us at the August 5th meeting.
Thank you all.